Your cat does this when it's secretly sick. Cats are among the most enigmatic companions a person can have. They are graceful, self-sufficient, and deeply private, qualities that make them endearing, but also make it remarkably difficult to tell when something is wrong. Unlike dogs, which tend to vocalize pain and seek comfort openly, cats have evolved an instinct to conceal their suffering. In the wild, showing weakness invites predators and threatens survival. Even in the safety of a loving home, this ancient survival mechanism remains deeply hardwired into their behavior. The result is a creature that can be seriously ill while appearing, on the surface, perfectly fine. And that is precisely what makes feline illness so dangerous and so easy to miss. One of the most telling and most overlooked signs that a cat is secretly sick is a sudden change in social behavior. A naturally affectionate cat that begins to withdraw, hide under the bed, or avoid contact may not simply be in a mood. Isolation is a classic coping mechanism in sick animals. When cats feel unwell, they instinctively retreat to quiet, dark, or enclosed spaces where they feel protected. Conversely, a typically independent cat that suddenly becomes unusually clingy or needy may also be signaling distress. Both extremes of behavioral shift, withdrawal and overattachment, deserve attention because they represent a departure from the animal's established baseline, and that departure is the key to reading feline health. Changes in grooming habits are another subtle but significant indicator. Cats are meticulous self-groomers. It is practically their full-time occupation when they are not sleeping. A cat that begins to neglect its coat, leaving fur matted, greasy, or unkempt, is often experiencing pain, fatigue, or systemic illness that makes the effort of grooming too demanding. On the opposite end, excessive grooming or compulsive licking of a specific area can point to localized pain, skin conditions, allergies, or even anxiety disorders. Neither extreme is normal, and both warrant a closer look. Appetite and water consumption are perhaps the most reliable windows into a cat's internal health. A decreased appetite, especially one that persists for more than 24 to 48 hours, should never be dismissed as pickiness. Cats that stop eating are at significant risk of developing hepatic lipidosis, a serious liver condition that can develop within days of food refusal. Equally concerning is the opposite, a sudden, dramatic increase in appetite or thirst, which can indicate hyperthyroidism, diabetes mellitus, or kidney disease. Because cats tend to drink very little water naturally, an evolutionary trait from desert-dwelling ancestors, a visibly increased water intake is a particularly reliable red flag that something metabolic may be occurring beneath the surface. Litter box behavior is another domain where subtle changes speak volumes. Owners who pay attention to their cat's elimination habits have a distinct advantage in early detection. Straining to urinate, crying out in the litter box, producing very little or no urine, or urinating outside the box entirely are all potential signs of urinary tract infections, bladder stones, or the life-threatening condition known as feline urethral obstruction, particularly common and dangerous in male cats. Changes in stool consistency, frequency, or the presence of blood should likewise be brought to a veterinarian's attention without delay. The litter box, unglamorous as it is, functions as a daily health report. Vocalization patterns also shift when cats are in discomfort. A quiet cat that begins yowling, especially at night, may be experiencing cognitive dysfunction, hyperthyroidism, or pain. Conversely, a normally vocal cat that goes silent may be withdrawing into illness. Some sick cats produce a low, guttural meow that differs entirely from their usual communicative sounds. A sound many experienced owners describe as instinctively alarming, even if they cannot immediately explain why. Trusting that instinct is often the first step toward getting a cat the help it needs. Physical signs, when they do appear, tend to be subtle at first. Weight loss is one of the most common and telling indicators of chronic illness in cats. Yet it often goes unnoticed because fur conceals body condition changes well. Running a hand along the cat's spine and ribs regularly can help owners detect changes that eyes alone might miss. Protruding vertebrae, visible hip bones, or a loss of muscle mass along the hindquarters are all signs of significant weight loss that need veterinary evaluation. Other physical cues to watch for include changes in eye appearance, cloudiness, discharge, or a third eyelid nictitating membrane that is partially visible, as well as pale, yellow, or grayish gums, which can indicate anemia, jaundice, or circulatory compromise. Respiratory changes also deserve vigilance. A cat that breathes with its mouth open, appears to be working hard to breathe, or whose sides heave visibly with each breath is experiencing a medical emergency. Cats simply do not pant the way dogs do. Any open-mouth breathing or labored respiration should prompt an immediate call to a veterinarian. Similarly, persistent sneezing, nasal discharge, or wheezing can indicate upper respiratory infections, asthma, or polyps, conditions that are manageable if caught early, but can become serious if left untreated. The central challenge of feline healthcare lies in the fact that by the time a cat appears obviously sick, the disease may already be significantly advanced. This is why veterinarians consistently recommend twice-yearly wellness exams for cats, rather than the once-a-year visit many owners consider sufficient. Blood work, urinalysis, and physical examinations during these visits can detect abnormalities long before behavioral symptoms emerge. Early detection of conditions like chronic kidney disease, hyperthyroidism, and diabetes can mean the difference between years of quality life and a crisis managed too late. Ultimately, knowing your cat, its rhythms, its quirks, its habits and preferences is the most powerful diagnostic tool available. No one knows a cat's normal better than the person who lives with it. The shift from normal, however minor it may seem, is where attentive owners must resist the urge to rationalize or wait. Cats cannot advocate for themselves. They are, by nature and by instinct, designed to suffer in silence. It falls to their owners to learn the language of that silence and to listen carefully enough to hear what is not being said.